Good afternoon. Welcome to My Advice and Build My Health webinar, Outflank your competition and with online quotes, and it's not by lowering your prices. Today, we're going to discuss the benefits of price transparency in healthcare. My name is Rachel Lemieux, and I'm the marketing director for My Advice. And we also have Chad Erickson here. He will be our moderator for the event and dealing with Q&A at the end. Some housekeeping tips before we jump in. We'll wait and answer all the questions until the end. We have a lot of people on, so we want to make sure we just kind of get to them all at the end. But as questions come up, please use that QA feature or the chat section. We'll keep a close eye on that and make sure that we get to all of these as we can. If not, we will get to you after the event. Our presenter today is Dr. Jonathan Kaplan. Dr. Kaplan is a board-certified plastic surgeon based in San Francisco and founder and CEO of BuildMyHealth, a price transparency lead generation platform. He's also a contributor to multiple publications, including Newsweek, Modern Aesthetics, MedCity News, and Medical Economics. And so, yeah, that's really it. Short and sweet. And I'm going to now turn it over to Dr. Kaplan.
Thanks so much, Rachel. Appreciate it. And thank you, Chad. Thanks, MyAdvice, for partnering with me on this webinar. And yes, I like to keep those bios short and sweet rather than going through all the different awards I won back in junior high. But yes, today we're going to talk about how to outflank your competition with online quotes. But I know you're thinking, oh, well, you just give online quotes and you make it as low as possible. That's how you outflank your competition. That is not how you do it. The way you do it is you capture the consumer's contact information before your competition does. Now, how do you do that? Stay tuned and we will explain to you how we capture that contact information before your competition so that you can outflank them. Now, if you think about your typical sales funnel, you've got, the people at the very bottom, those are the people that are ready to come in, but there's going to be fewer of those people. So you really need to be generating a lot of leads from the top to get them through that sales funnel. So eventually you'll have as many people as possible who are pulling that trigger and getting a procedure done. And this is either a medically necessary, non-urgent procedure or an aesthetic cosmetic procedure. So you've got the people at the bottom who are ready to book online, and so that's great. But again, few and far between. Then in the middle of that sales funnel, the call to action button that you have on your website that will get that person's contact information, you could have the contact submission form. The only problem with that is you then have to manually respond to that, book online or give us a call. Those are great call to action buttons, but again, not everybody is going to be ready once they get on your website to call somebody, to talk to somebody. Maybe they just want to look around. But the thing is, you can't just follow a bunch of clicks on your website. You need to find out who these people are. So you need to have a great call to action button that will get people that are just starting the research at the top of the funnel, and then also getting everybody throughout the entire funnel. And so what I have found, the call to action button to put on your website to end all call to action buttons, the mother of all call to action buttons to get the person's name, email address, and phone number is get a quote now. Having that button on your website, that captures everybody's attention. Everybody wants to know that. And it doesn't make them a price shopper just because they want to know how much something costs. I mean, think about, put yourself in their shoes. If you're going to a car dealership, you want to know how much the car costs before you go. If you're going to an open house, you want to know how much that house costs before you go. You don't want to waste your time. Patients are the same way. Again, they're not necessarily price shoppers. Some of them may be, but some of them are serious customers or consumers that just want to know how much it's going to cost before they get in. So giving them that opportunity to click on get a quote now to get that instant gratification to find out how much it costs in exchange for their contact information is a great way to generate leads and outflank your competition. So in this example, this is Dr. Russell Babbitt. He's up in the Northeast. He is a MyAdvice client. And just to clarify, this is a great website. I love his tagline, a tailor for your birthday suit. But just to make it clear, MyAdvice does not plaster their logo across every website they do. That was just to highlight that it is a MyAdvice website that he likes, I'm very happy for him that he's got a great looking website that they have produced. Now, one of the things about this website is that it's got several great call to action buttons. There is the request a consultation. There is also get a quote now. There's also a call to action button of a phone number. And there's also the call to action button of a chat bot where the consumer can check pricing. So these are all great call to action buttons. However, there's some that are going to be more likely to capture somebody's attention. Again, person may not be ready to schedule a consultation. They may not be ready to call and talk to somebody. I'm not saying don't put those call to action buttons on there. You absolutely, I mean, if you look at my website, those call to action buttons are on there as well. But there's just some that may be more likely to get person into your sales funnel to capture their contact information. So I want to show you the chat bot that our platform has created. The way that chat bot works on Dr. Babbitt's site and all of our other providers' websites is the consumer can click on that chat bot. They can choose a category, and if it's an insurance-based service, they can choose their insurance plan. But listen, this example, they're going to choose breast lift with silicone implants. They're going to put in their email address, and we don't show them the price right there on the chat bot. We require them to put in a real email address so that when they get an email, if they put in their correct email address, that's when they'll get their estimate. So this email goes out automatically to the consumer so they can see a breakdown of all the cost, and then they can also see the patient's email address that they just entered. And so this is, of course, my example for me. But you can also, the doctor can actually turn on several other things. They can say, well, we also want their first name, their last name, their zip code. Dr. Babbitt has chosen not to ask all those things, and that's fine. He just wants to be quick and dirty, and that's totally fine. But the doctor, when they choose to put a chatbot, our chatbot on their platform, they have the ability to decide how many different things, how many other different bits of information they want to request. But either way, the patient has to at least put in an email address so they get an estimate and your office staff gets an estimate, and so they can see the patient's contact information and follow up with them. Now, there's also the other call to action button up at the top, which is get a quote now. And that is just a more fully functional price estimator that can live on your website. And this is, again, a price estimator that we've embedded on Dr. Babbitt's website through MyAdvice, through their cooperation. And the consumer can choose a different category on the estimator. They can actually type in a CPT code or a keyword to find the different procedures. They can even look at the different filters, kind of making it an Airbnb experience. They can choose multiple categories. Like breast and injectables, and then they'll see all of those different services right there on the page for them to choose from. And if there's videos, you can look at videos for each procedure, before and after photos. But you just add these items to your wish list, like breast reduction, Kybella, 5 vials, and then you go, and when you go ready to check out, we ask a couple more questions just to see how serious you are, how soon you're looking to get these services, and if it's okay for us to follow up with you. And then when they go to check pricing, they have to create an account, put in all their demographic information, or they can just use Google single sign-on, which consumers love. It's very easy to use, or they just log in with their existing account, and then they'll see on the screen, once their email has been verified, a breakdown of all the pricing for that surgical procedure, the OR fees, the total cost. They can then schedule a consultation, even upload pre-consultation photos, and apply for care credit, which brings them directly to Dr. Babbitt's specific care credit page. So when they fill out an application for care credit, he gets that. It's not just some generic application. And of course, another email goes out to both the patient and to the office staff to be able to follow up with the consumer, and the patient has a breakdown of their estimated cost. So again, a really easy way for the consumer to get the information they all want. They all want to know how much something costs, and then they have to put in their contact information to get it. So we're not just like listing a menu of prices on your website. That's not very helpful because you don't generate any leads in the process. So that's how it works. And I understand that people are anxious about providing pricing on their website. They have like multiple different reasons. They're, afraid, oh, well, there's too many variations based on body habitus. But you can have different procedures listed, breast dog and lift, breast dog lift with ideal implants, shaped implants. You can provide, just stratify all those different options for the consumer so that they're more likely to choose the right procedure, or tummy tuck, extended tummy tuck, or mini tummy tuck. The other concern doctors have is that, with all the different insurance plans, how does the patient really determine what their out-of-pocket cost is going to be specific to their insurance and specific to their, out-of-pocket cost, how much they've spent towards their deductible in that calendar year. I'm going to show you how you can use a price estimator to provide the patient with that information as well. There's also the other dogma that online estimates are too inaccurate. I'm going to go over some data of why I think that it is accurate enough to be useful. You can be worried that your competition will see your pricing. Well, that's true. They can go through the price estimator and put in their own email address, and you probably would know who they are. But the alternative is, if you don't have a price estimator on your website, then your competition is going to be calling your office and wasting your front office staff's time asking about pricing. And we already know there's already a ton of patients calling, and other offices calling your office, asking how much things cost, and it just is a huge time suck from your office staff when they could be doing other more productive things. So by allowing the consumer or your competition to check pricing on your price estimator on your website or your chat bot, at least they're doing that in an automated way and not taking any time from your office staff's busy day. The other thing is people worry that they're going to focus on price rather than the doctor-patient relationship. And I understand those concerns, but the thing at the end of the day, if the patient can't afford it, they're not going to get it. If they can't get the financing, they're not going to get the service. So why bring them in for a consultation where they're going to disclose their deepest insecurities and it's going to end in sticker shock? That's not a good experience for either the provider or the patient. So we are just trying to avoid those possibilities here. So next, what I want to talk about is that, the thing is, the customer wants this. They want pricing. So I think there is a way for you to meet them halfway. I don't think the customer's always right, but I do think there is a way for you to meet them halfway and address their concerns, address your concerns about, at least getting something in return, generating a lead. It benefits the practice, and you're going to comply with the No Surprises Act, which I'm going to go into in a second. But the No Surprises Act is a federal law that applies to everybody. I know a lot of people think that if they're in aesthetics, it doesn't apply to them, but it really does. And I'm going to get into that in more detail in just a second. The other benefit of price transparency, and something I alluded to before, is instead of people ending a consultation in sticker shock, we found in this peer-reviewed article that we had published that patients, when they come in and they're price aware, they're 41% more likely to book a procedure than non-price aware patients. So just more patients moving from the exam room to the operating room, less futile consultations ending in sticker shock, and just a waste of time for everybody. Now, as far as the accuracy or inaccuracy of the quotes, this is a study that we did in my practice, and that I want to just highlight a few numbers here. So we found that the average discrepancy between the estimate the patient got online versus the final quote they got once they came in for a consultation, the discrepancy was 12.4%. It's not the end of the world. That's $8,000 procedure. Maybe it was off by $980. Again, not the end of the world. The patient is told ahead of time before when they're scheduling their consultation, okay, that estimate you got is an estimate, and then you can maybe potentially send them other estimates if you're afraid that they chose the wrong procedure. And one of the things, if you look over here, that when patients came in and the ultimate price was higher than what they were expecting, still 59.5% of the patients booked. And if the final estimate was lower than they were expecting, then not surprisingly, a few more people booked, 79.2% of the people booked. But what I want to highlight here is that the odds ratio of 0.8, what does that mean? That means if you take 10 patients who came in whose final cost was lower than they were expecting, if all 10 of them booked, then that odds ratio means that the odds are that 8 patients that came in whose price estimate was actually higher than what they're expecting, they still booked. So it's not a huge discrepancy there. I'm not saying that, when the price was less expensive, 10 people booked, and when the price was more expensive, only 1 person booked. I'm talking about 8 people booked still, even though it was a little more expensive than they were expecting, only 2 off from the patients whose final estimate was less. So just to really highlight that the overview is that even though the price may have been more expensive than what they were expecting based on their previous estimate, it was not deterring all of these patients in droves. 8 of them still booked when even and compared to the 10 that booked when the price was a little lower than they were expecting. So I don't believe that is an estimate that's so unuseful or so inaccurate as to be worthless for your practice. I still think the benefit of giving a patient a good idea of how much it costs, generating a lead in the process, makes online estimates very, very useful. It also has some big benefits when it comes to the No Surprises Act. So I want to go through just some background on this and then explain to you why allowing patients to check pricing online benefits you in the process of complying with the No Surprises Act. And this does apply to all providers. You may be thinking, oh, I'm a med spa, it doesn't apply to me. I just do aesthetics. I don't deal with insurance. I don't send out surprise bills. It doesn't apply to me. Unfortunately, at this point, it does apply to you. And I'm going to go through why it applies to you. But this has been the law of the land since January 1st this past year. So to some extent, we're all non-compliant already. This is not something you can just say, you know what, this is eventually going to come down the road and I'll comply eventually. It really is already the law of the land, as I mentioned. This applies to 2 big categories. First, we're going to talk about it applies to the patients who are not using insurance. You have to provide a patient with a good faith estimate if they are uninsured, or if they have insurance but are choosing not to use their insurance. Like, for example, the MRI is less expensive if they pay cash rather than submit it to insurance. Those patients have to have a good faith estimate if they're choosing not to use their insurance or their self-pay. And in this category, the way the law was written, self-pay also includes aesthetics. So you may be wondering, well, do I have to give a good faith estimate for somebody that just comes in for one-off Botox or one-off filler? No, you don't. But if you're offering memberships, subscriptions, things that require repeat sessions, then you do have to provide people with a good faith estimate. So if they're coming in with that Kybella example where they're getting multiple treatments of Kybella, you have to provide them with a good faith estimate that includes them with all of the potential cost of the Kybella for all those sessions. If you are doing a procedure at a surgery center or a hospital and they're paying cash for it, then that means that's going to be a surgeon's fee, an OR fee, an anesthesia fee, maybe lab or pathology fee. When it's all those multiple fees, multiple providers, you have to provide a good faith estimate when they're paying cash for that instance. So I'm trying to make the point that even though you think you're going to be able to get out of it, if you're offering laser hair removal that requires 6 sessions, you got to provide a good faith estimate. If you're a family therapist and you're doing 6 sessions with a family, you got to provide a good faith estimate. So you're not excluded from the good faith estimate at this point when patients are not using their insurance, they're self-insured, or uninsured, or they're self-pay. So that's one major category. The other major category is if patients are using their insurance and they're out of network. If they're going out of network, and I know there's some people on this call that take insurance still, that if they're going out of network with you, if you provide out-of-network services, not only do you have to provide them with an estimated cost of what their out-of-pocket expenses are going to be if they're going out of network with you, you also have to provide them with a consent that they must sign saying that they understand they're giving up their rights to avoid surprise bills. They understand they're going out of network and that they're going to have to incur the bills associated with going out of network. So 2 major categories with the No Surprises Act: not using insurance when it's out of network. That applies to all providers who are offering those services. The other thing that applies to all providers is that you all have to put 2 notices up by your front desk or wherever patients check in or schedule appointments or schedule procedures or pay bills, wherever that is within your surgery center or your office, you have to put 2 notices up. One notice is a standard notice saying that patients have a protection against surprise bills. The other notice is saying that the patient has a right to a good faith estimate. So you have to physically post these at the front desk. You also have to put them on your homepage of your website. You don't have to put the whole notice on the homepage. You have to at least have a link on the homepage of your website. And MyAdvice, of course, can help you comply with that. These different notices, if you want a copy of them, you can download them at nosurprisesact.com. It's the bolded URL at the bottom of the screen. But if you go to nosurprisesact.com, you can download these 2 notices that you are all required to put at your front desk. And I'm sorry to say it, but you do. So moving on. How are these estimates different? The good faith estimate for cash pay versus the estimates that you're doing for out-of-network services. So at the good faith estimate, you have to have the cost for each provider or for multiple sessions, as I mentioned before. So again, if it's going to be at a surgery center, you got to include the cost for your fee, the OR fee, the anesthesia fee. And most of people who are operating at a surgery center, they already have the fee schedules for the OR and the anesthesiologist. So you just need to incorporate that into your good faith estimate along with your fee. And if it's a breast reduction, for example, that they're paying cash for, and you're going to send it off to pathology, you need to include what the cash pay rate for that pathology is going to be. So you have to include all of the providers that are involved. And if it's a service that requires multiple sessions, you have to provide that estimate. And then you have to also provide a disclaimer that says that if they get a surprise bill for a service that they should have known about ahead of time, so not an emergency crazy thing that happened, but something they should have known about ahead of time, if you send them a bill for that expected service after the fact that you didn't disclose before and it costs more than $400 than what was included in the good faith estimate, then they can launch a dispute against you. So you have to provide them with that disclaimer, letting them know that they can launch a dispute if it's greater than $400 for a reasonably expected cost. Again, if it's like some crazy emergency thing, they had to go to the hospital, whatever, that they can still launch a dispute, but you're going to win that dispute because that was not a reasonably expected service. But you have to provide the good faith estimate with a disclaimer. So that's for cash pay services. For out of network, you have to provide the cost of your service, not everybody's services, that's not built out yet, but for your services, you have to provide them what their estimated out-of-pocket cost is going to be based on the out-of-network allowable, based on what you're going to balance bill them, based on what they've already paid towards their out-of-pocket, their deductible, their out-of-pocket maximum that year for their out-of-network benefits. If they don't have out-of-network benefits, then you got to let them know that they're on the hook for the whole thing. So you got to give them that cost for you for that out-of-network service. Plus, you have to provide them with a consent saying that they're agreeing to go outside of their network. So I want to just show you a couple things of how this all ties in to having a price estimator on your website. So in that first example, through the price estimator, the consumer chose, or the fake consumer, me, chose Kybella, which requires multiple sessions, and a breast reduction being done at a surgery center that has multiple providers. So both of those procedures are candidates for the good faith estimate. So when the patient submits that estimate through the price estimator, it shows up on this dashboard that the office staff will have with our platform, the BuildMyHealth platform. This is the dashboard that the office staff sees. So instead of the patient coming in and then after the consultation, you having to create a quote, a good faith estimate from scratch, you can actually take their existing estimate that they already submitted and update. You can switch it to the good faith estimate, which requires a few things. You can determine their marketing channel that brought them in. You have to include the diagnosis code. You can change the order of the procedures. You can update the procedures. Maybe they chose the wrong procedure, but you can create this estimate for them based on their estimate or update the estimate based on their estimate, review it, and then you create a PDF that is No Surprises Act compliant. This is what the federal law requires, is that it's got to have their demographics, the cosmetic diagnosis code, a breakdown of all the procedures, including multiple sessions. And this is that disclaimer I was talking about. This must be included in the quote that says that if they get a surprise bill after the fact that's more than $400, they can launch a dispute. That has to be included. And at the bottom, they sign it. So just like you are normally having your patients sign the quote, now they're signing a quote that is a good faith estimate, is in compliance with federal law. So that's what's really nice about having them submit the estimate ahead of time. You can just take that and run with it, update it as needed. You don't have to start from scratch. You don't have to pull out a few additional sheets of paper out of a drawer. It's all included in your quote. So when it comes to insurance, this is pretty awesome what I'm going to show you here. If you offer insurance, patients can actually check their estimated cost out of pocket specific to their insurance plan and specific to what they've spent in that calendar year for their deductible and whatnot. So here's an example. Again, on your price estimator, if you offer insurance, they will get on that page. They will choose their insurance plan. We're going to choose United Healthcare because that's mine. And after they choose that, they can scroll through all the different categories you offer. Maybe it's a surgery center or a hospital they're looking at. Maybe it's your office. And let's say they're considering getting an upper GI, an endoscopy, like an EGD. They can choose that category, or they can go back to the filters, choose a couple different categories if they know they need multiple services that are going to be covered by insurance. They can even switch their insurance, or they can, as I mentioned before, they can search the procedure, for example, EGD. They can put in the CPT code 43239 if they happen to know it because they already saw their doctor and they told them that's what they needed. They can add this item to their wish list. And then, since it's a little different, it's insurance, we can ask them what their deductible is, what their out-of-pocket maximum coinsurance is, but they probably don't know that off the top of their head. But they do have their insurance card in their wallet or their purse, and so they just put in their member ID number, their first name, last name, date of birth, and again, we still ask them for contact information, and then our system can provide them with the negotiated rate that you've uploaded, but then we can also show the ancillary fees, and then because we're doing the real-time eligibility, we're able to see how much they put towards their deductible out-of-pocket maximum, so they can see what their out-of-pocket cost is going to be versus what the insurance is going to pay. And then there's also an email that is sent to them and to the office staff. So if anybody is watching that is used to dealing with insurance, you know this is called real-time eligibility, that you're used to doing this by the back office staff calling the insurance company and you're waiting on hold to find out how much they've spent towards their deductible. Well, now instead of you sitting on hold trying to deal with all this, this is all being pushed to the consumer and letting the consumer do it, taking all that headache off your back office staff, reducing their potential for burnout, letting the consumer know that, yes, even though I have insurance, I still owe something out of pocket. And that helps them with their healthcare literacy, or their health insurance literacy, I should say, because patients come in all the time. Even I feel it a little bit when I go and I go see a doctor and I still have to pay a copay. it aggravates everybody. They're like, I have insurance. Why do I have to pay a copay? Well, if they are upset about a $40 or $50 copay, they're certainly going to be upset finding out that they owe $1,800 to get that out-of-pocket service. So now you're providing with that information ahead of time. So by the time they come in, they're prepared and they're less likely to yell at you or your business manager when they let them know, it's like, oh yeah, that price that you owe, that is what you owe out of pocket before your insurance will kick in. And then once they come in for the consultation, you can provide the official No Surprises Act quote for them that includes all the demographics. In this example, just the diagnosis code, a breakdown of all the procedure pricing, and because it's out of network, showing them what their out of network responsibility is. And this is that surprise billing protection form that the federal government has issued that you must include if you're going to have a patient do an out of network service. They have to have this consent saying that they know they're giving up their rights to surprise billing or surprise billing protections. And then they sign the quote along with the consent, just like they would have signed the quote anyway. So that's just a really nice way of allowing the consumer to submit the wish list ahead of time, the estimate ahead of time. And once they come in for a consultation, you pick up where they left off, you update it as needed. Maybe they needed a different procedure, you resubmit that because you've already got their insurance information. You just resubmit that real-time eligibility and update the quote as needed. So again, letting them check that price, come in for the consultation, get the official quote, update it, and then produce the good faith estimate or the out-of-network estimate plus the consent form. So pretty cool. Other benefits of price transparency is that when you upload your procedures and pricing to our platform so that the patient can have that price estimator on the front end that they can choose procedures from, that when you upload the pricing, you can see how your pricing compares across our network. So the consumer doesn't see this breakdown of pricing, only the provider does. And you can see how your prices compare from the top level at the US all the way down to the zip code if we have the data. Just helps you determine where you fit within the competitive landscape. We do it for non-surgical services. You can see how your prices compare for lip injections and even for insurance-based services, a CT scan. So maybe there's no radiology facilities on the call, but this is for even breast reductions that are covered by insurance. We can upload with our proprietary tool, upload all of the negotiated rates you have in your spreadsheet. So you don't have to enter each one of those in. We can do it really easily for you, but you can also see how your negotiated rates compare to everybody. So you can see how good or more likely, unfortunately, how bad your negotiated rates are because everybody's rates are kind of bad now. But anyway, it's just really nice. Even for insurance, you can see how your rates compare. So resources. Again, you can head on over to nosurprisesact.com. You can download those notices. Those 2 notices you have to put at the front desk, but you can also download those disclaimers, the consent form for out-of-network estimates, the disclaimer for good faith estimate. You can download all of that at nosurprisesact.com. If you want to read an overview of the No Surprises Act, this is an article I wrote in Newsweek. You can just Google it. I wrote this actually with U.S. Senator Bill Cassidy. He is a gastroenterologist, specifically a hepatologist, and he was one of my professors in med school. And so I met him back in med school. We've stayed in touch over the last several years because he was always working on healthcare price transparency. I've been involved in healthcare price transparency efforts. And once he got this No Surprises Act passed, he is the co-author of it. He's actually a Republican, and he passed the No Surprises Act as the co-author with Maggie Hassan, a Democrat from New Hampshire. So it's true, bipartisan efforts, we can still get along and get things accomplished. But he was the co-author of the No Surprises Act. So I wrote this article with him in Newsweek that just gives a nice overview of the No Surprises Act. So feel free to read more about that because so many people don't even know this act exists, and so many people don't know that it actually does apply to them as a provider. But in conclusion, capture more patients before your competition does by offering them estimates and generating leads. That way you can generate a huge email database of leads so that if Google's not treating you right with the algorithm, your Instagram's not giving you too much love, then if you have a huge email marketing database, then you own your marketing. Then you don't have to rely as much on Google or Instagram. You can just send out a big a big e-blast once a month or once a week, letting people know the services you offer, and then you can own your marketing. And then also use this No Surprises Act legislation as an opportunity to streamline your workflow. I mean, you're already doing a lot of these things. You're already creating quotes. Now just use it as a way to do it more efficiently. So don't think of it as a burden, but as an opportunity to create those No Surprises Act compliant estimates and also allow the patients to do all of their real-time eligibility for insurance-based services. So thank y'all so much. I'm excited to take some questions. And also, If anybody is interested, you can use the promo code MyAdvice to get a 10% discount on an annual subscription. All you have to do is head on over to buildmyhealth.co/providers. That's buildmyhealth.co, not .com, /providers. And again, you can download all those resources at nosurprisesact.com. So hopefully we have some questions, and you can start entering them into the panel over there on the right. And let's get to it, Chad.
Sounds great. Dr. Kaplan, thank you. It's always fun to connect with you. I mean, I was able to see you at the ASAPS conference in San Diego, a couple months ago, and catch up briefly as you were coming in to speak for the day, and I was heading back out as well. But always good to see you, and appreciate you taking the time from your busy schedule to be here and to educate.
My pleasure.
Everyone who's here today. This is such an interesting thing, right? And the price transparency is unique. I've been now in this market and helping consult doctors for well over 20 years. And I remember years ago, it was all about, doing secret shoppers, right? And could you get your staff to go out and do those? You talk about how it just clogs up the funnel, right? Now you think you got this lead, but why is this person ghosting us? Well, it's because they're fake.
Right, right.
So the prices are known, right? So your competition knows them. So, even in our space, everyone knows what we charge. We know what all of our competitors charge. And so trying to hide it really isn't doing anything. So the transparency really is the way that things have really progressed in today's world. And so it just makes sense. So a couple questions that came up is, this looks amazing. How long does it take to set it up initially?
Oh, well, actually, people don't believe me, but if we have a web developer like y'all that is cooperative and an office staff that is on it, then they can actually go live with this within 24 hours. So usually what happens is the office staff will either send us an Excel spreadsheet, and we have a proprietary upload tool that we can upload that spreadsheet of all their procedures and prices. And that's actually even more important if it's like an insurance spreadsheet where it shows all the insurance plans, all the CPT codes, and all those rates for each insurance plan. We take that Excel spreadsheet, we upload it, does it within seconds. And so everything's populated in our database, and then you can go in, you can see how your prices compare. And then once you sign up officially and you've put in those procedures, and it's unlimited number of procedures and pricing, you can even choose different locations if you operate in multiple places, if you have multiple providers, we can stratify it all like that. But the point being is after you've uploaded all those procedures, your office will get an automated email. They don't have to wait for us to email it to them. It's an automated email that sends them a line of code. And that is forwarded to your web developer, and the instructions are on that in that email, where the web developer can just upload that one line of code to the website, and the price estimator populates on your website. It's a separate line of code for the chat bot. The only thing we ask the web developer to also do, the best practices, are to add a get a quote now button to the desktop and mobile page, homepage of the website, because you really want that get a quote now call to action button obvious at the top of the page. Because if the consumer doesn't see that, they can't find the price estimator, you're not going to generate any leads. So you want that get a quote now or something similar call to action button at the top of the page on desktop and mobile, maybe even a pricing tab. But this literally can all be done within 24 hours because we make it so easy with this, again, proprietary upload tool where everybody's got these prices in a spreadsheet typically, and or our team can upload it for you, or you can upload it. It's totally up to you. But this truly can go live on your website within 24 hours.
That's awesome. And, I've seen a lot of practices increase in their costs right now. Seems like that's across the board. Everyone is dealing with inflation, and that means higher salaries, which means you got to figure out how to pass that along. So if they have to update their pricing, is that something they do on their own, or do they have to contact you?
No. This is all, we've built our own content management system. They can log in themselves. Again, they can upload the pricing initially themselves, or if they want to go in and make edits, they can go in, they can edit, they can delete, Perfect. They can increase pricing. But something that's, they can do all that on their own. So it really is easy. They can upload photos, videos, all that is very easy. But something I didn't talk about that this is really cool is that when the patient in the workflow, when the patient submits that estimate, then they come in for a consultation, we go to create their No Surprises Act quote. We actually are tracking which procedures they're booking. We're creating a quote, so we know if we know this person booked a BBL, we know this person booked a breast aug. So our system, if you want to turn it on, it doesn't happen automatically. If you want to turn it on, you can turn on surge pricing. And what that does is that keeps track of whatever procedures are being booked the most. And if you choose to say, okay, for every third time this same procedure is booked, or every fourth time, or every fifth time, whatever it is you choose, every fifth time, for example, that particular procedure is booked, not just an estimate, but actually booked, then the price goes up a certain percentage. You can set that to 2, 3, 4, 5%. So we have that for all of our surgical procedures that, yes, you can go and you can increase the price if you want, but instead of you haphazardly and intermittently increasing pricing because of inflation, you can set up surge pricing so your prices automatically go up consistently year round, methodically go up based on whatever trigger you've decided on and whatever percent amount. So I think for Brazilian butt lifts, I think every time a fourth person books a Brazilian butt lift, the price goes up by 3%. So if 4 people book in a week, the price goes up after a week. If 4 people book in a month, the price goes up after a month. But it never goes down. It only goes up or stays the same.
That's brilliant. And
so if
I
Uber and
love
Lyft can have surge pricing, why can't we?
Yeah, absolutely. I think it makes sense. One of the things you said during your presentation that I found really, really important is that a practice could view this as really a burden, right? Wow, this is federal government's getting too involved. They're overstepping, blah blah blah, whatever. But the reality is that you framed this really as an opportunity. If I'm thinking about it, I take a step back and I don't think about I've got to do one extra step now in price transparency, but I see it as, wow, I'm actually going to save myself a lot of time and effort, and this tool is going to make it my process in my office better and save me time. That seems like a no-brainer, right? And that's where I think I hope our audience heard that as well. Recognizing that technology that's coming out today is all about helping you simplify. We recognize that hiring and retaining employees is tough today. So if you can automate various aspects of the business or make the burden that's on the shoulders of your staff easier, why wouldn't you do it? Because at the end of the day, right, the cost to replace somebody is exponentially higher and train them up. And so if you can just make their life easier and take a burden away from them, you're gonna be a lot better off down the road.
I mean, just
one of the other
a few examples I mentioned is that if people are calling asking about pricing, you can offload that to the price estimator. Now, if they do call and ask and they didn't already check pricing on the website, I wouldn't say, oh, go just check pricing on our website. That's not good customer service. But through that dashboard that I was showing, that if somebody calls asking about pricing, our office staff can submit a wish list on their behalf while they're on the call. So instead of saying, oh, you got to come in for a consultation before we give you a price, or spending 10, 15 minutes going over all the pricing information, just say, oh, no problem. We'll send you an estimate right now. What's your email address? Oh, I don't want to give you an email address. Oh, well, our system does it automatically where we send you an estimate, but it requires an email address. So it's the system. It's not really us. Oh, okay, if it's the system, I'll do it. And if you blame it on the system, they'll do it. And so it's just much more efficient. So now you're not wasting a ton of time on the call. You're not going through some silly scripts beating around the bush. You're just sending them an estimate if they didn't already check it online. But then the other things that are automated is that you're gonna have to create a quote from somebody for somebody that comes in for a consultation anyway. Why not have the quote sort of already sitting there based on the estimate that the person already submitted? You can just work from that. Why take the sheets of paper out of the drawer to add on those new requirements of the No Surprises Act? It's already included in the quote. Why call the insurance company to find out how much this person's put towards their deductible? They already did it on the front end. I mean, those are just all the examples that you're talking about, that you're doing these things anyway. Why not do it more efficiently?
That makes perfect sense to me. The penalties for not following this. So, and I bring that up because I'm well aware of some of the legal trappings that have been happening recently with doctors that are not ADA compliant on their website. And there's some lawyers going after some of those. But in this case, outside of the above $400, right, where they could dispute something, is there a penalty as well that can be levied? If so, what is that?
So it's pretty hefty. If you are found guilty of violating the No Surprises Act, and being found guilty can come in many different ways, but it's $10,000. That's the short answer, is the violation of the No Surprise Act is $10,000. So if you bill somebody out of network, if it's insurance, you bill them out of network, but you didn't get a consent form, that's a violation of the penalty for, because you have to get permission. The other thing to clarify is that sending somebody a bill after the fact is not illegal. It's sending somebody a surprise bill after the fact is illegal. So all we're saying is provide pricing information up front. That way, whatever bill you send after the fact is not illegal. So perfect example, like say a tummy tuck. Some people will say, oh, well, I'd do a 2-hour tummy tuck, but sometimes it takes 3 hours. So give the patient the good faith estimate of a 3-hour tummy tuck. And if you choose to only take the money for the 2 hours, that's on you. And then if it does end up taking 3 hours and you send them a bill for the balance, you told them about that 3-hour possibility with the good faith estimate. So you sent them a bill, even if it's over $400, that's not a violation because you told them about it ahead of time. It's just the surprise bills that's the issue. Now, going back to the good faith estimate, what I said is that it's got to include reasonably expected costs. So the OR fee, the anesthesia fee, your fee, those are reasonably expected. But if they have a PE during the operation, they need an ambulance, and they go to the ambulance, they have to go in the ambulance, they don't have insurance, and they have to come up with a several $1,000 bill to pay the ambulance. I guess they could technically still launch a dispute just the way anybody can sue you for anything, but they will not win that dispute, even though it's more than $400, even though it is a surprise, no doubt about it. It was not a reasonably expected outcome. So I think it's pretty easy to avoid getting that $10,000 penalty as long as you just provide the reasonably expected cost ahead of time. Sending a bill after the fact is not illegal. It's just a surprise bill is what's illegal.
Got it. So in my case, I've got gonna have my ACL rebuild here in a week and a half. So prior to that surgery here in 10 days, I'll have an office. It's already scheduled, but I'll have a call with the office. They're going to go over pricing in advance of kind of, here's the estimates for the surgeon, for anesthesia, for the surgery center, etc. And I'll have a pretty good estimate of where that is. And that's right. And then they're covered. That's correct.
That's correct. And then also it gives them an opportunity to ask for whatever money up front that you have to pay, if you haven't met your deductible yet, or you're out of pocket maximum and you have to, whatever your co-insurance is, that gives them an opportunity, because they're telling you what it's going to potentially cost. They're going to get that money up front, and then your insurance will hopefully take care of the rest. But yeah, that's the other benefit of telling people how much it costs ahead of time, is because you can collect your portion of it ahead of time, of whatever part is going to be out of pocket.
Yeah. So again, I like this because we're talking about the benefits of this, which is really, really important. The other thing that I love that you do, Dr. Kaplan, is we're very like-minded, right? The idea of the marketing that we do is very much aligned with what you're talking about. We're all about top of the funnel. Everything we do is all about making the phone ring, getting a lead into the system, and that's where we're really good at doing that. One of the things that, and you'll understand this and be able to talk about this more than I am because you're there and you live this all the time, but it's a principle that our friend, because we've spoken together and been on faculty with him, as Jay Shore talks about, that the most important person in the office is that person of first impressions. So maybe talk about that for a minute, of the response to those emails, how quickly they need to get on top of that, phone calls coming in, and making sure that first impression is up and really solid. To make sure that you're hitting that 0.8 number, right? Because you've weeded out some of the other ones, and the reason you're able to close that high rate is because you're responding.
Correct. And so first off, it is definitely from a patient satisfaction standpoint. I mean, any of the 5-star reviews I have on Yelp or Google are patients, they always mention the fact that they were able to check pricing on our website. That's one of the things they include. So patients really do want this, but we should do it on our terms so we generate a lead in the process. So as far as how quickly we call them back, so keep in mind, they always say you should call people back within a couple minutes. But the way I look at it, I look at it a couple different ways, is that you might not have to call them back as fast with this because they got the information they wanted. They were wanted to know cost. And so they got that information immediately. So to some extent, you've already satisfied that 2-minute time limit because they got that information immediately. And then the other thing we do is, you might have seen it during the demo, is that we ask them if we can follow up with them. And so some patients will say, absolutely, I want to talk to somebody, or okay, I have a few more questions, or no, I was just checking pricing. That's another big patient satisfier, is that we know ahead of time that we shouldn't call this person back. It's just going to irritate them. And so that helps weed out some of the people that were just checking pricing. Whereas the people that say okay or absolutely, we definitely call them back within a couple minutes. But I guess my point is that it could be 5 minutes and it would probably be okay, because they actually did already get the pricing information they wanted. The other thing is that within the email or that final pricing page that they see, they have the opportunity to book a consultation, to upload pre-consultation photos, to fill out pre-consultation paperwork, and to also get financing. So we're actually pushing a lot of things online for them to try. And so some of the things that maybe you would do if you called and followed up with them, we're trying to get the patient to do a lot of those things on their own, so that by the time they come in, they've already filled out the paperwork, they've already got finance, they already have a good idea of the cost. And even if they have fit, once they come in, they really need something that's about $3,000 or $4,000 more, well, at least they got partway there with the financing they already applied for. So yeah, we do call them back quickly, but we have the luxury of knowing who doesn't want us to call them back at all or quickly. And no matter what, they're being added to our email marketing database. So whatever, MailChimp, MyEmma, Constant Contact, whatever email marketing platform you use, we automatically sync to that. So you are just passively building a huge email marketing database no matter what.
That's awesome. Well, you've built an amazing tool, and
thank you.
Again, the fact that you can automate so much of this and really make their life easier for each of these practices is huge. So thank you, and thank you again for taking the time to be here with us today. I asked Dr. Kaplan to leave the information up here. You, again, go download that information. If you do choose to sign up with them, which I strongly encourage you to do, use the promo code MyAdvice, get that 10% off of your annual subscription with BuildMyHealth, and feel free to ask Dr. Kaplan any questions. Yeah.
I'm sorry to interrupt you. I apologize. I just realized we're talking about price transparency. We haven't told anybody how much this costs. It's a little unfair.
Go for it.
What are you getting 10% off of? Okay, so if you're a solo practitioner, the whole platform, including the price estimator and the chat bot, is $2,999 per year for a solo provider. If there's multiple providers with different fee schedules, then there is an additional 50% cost for each additional provider. If you are planning on using the insurance part of the platform, that's $29.99 if you're a solo practicing provider. But each time the patient checks their insurance with that real-time eligibility tool to see how much they would owe out of pocket based on their deductible and all that good stuff, each time they do that, that's an additional 25 cents. It costs us money, so that's why we pass on those costs. If they're just checking cash rates, there's no additional per estimate cost. It's just that flat $29.99. If you're a surgery center, it's more expensive. If you're a hospital, it's more expensive. But anyway, at the most basic level, for whatever providers out there that's interested in this, it's $29.99 to start. And that could theoretically be the total cost for the whole year if you don't have additional providers and all those other things. So there we go. We've kept our part of the bargain for price transparency.
So there you go. Again, reach out to Jonathan at buildmybot.com. Dr. Kaplan, thank you for, again, taking the time to be here. And we'll have this recorded. So if you want to watch it again, it will be sent out to you. There might be some in your practices that you're like, wow, I got to share this with somebody else. Please do. Please feel free to share this link with anybody that you feel would benefit from this. So we appreciate it. Have a wonderful rest of your week, and we will talk to you soon.
Good luck on your surgery. Thanks so much for having me.
Thank you. Bye-bye, everyone.